I'm Charlotte Stephanie Bird. This is validation video number 4. In this room, yes. Okay. This is validation video number 4, and this is my patient Emily, and she has agreed to do this today. And this is the assessment of the musculoskeletal system and the neurological system. First, we're going to start out by range of motion of fingers, and we are going to be, it's going to be flexion, extension, abduction, adduction, and the wrist is going to be flexion, extension, radial deviation, ulnar deviation, and the elbow is going to be flexion, extension, supination, pronation. Shoulder is going to be circumflexion, abduction, internal rotation, external rotation. The neck is going to be flexion, extension, rotation to the right, rotation to the left, right lateral bending, left lateral bending, and the spine is going to be flexion, extension, rotation to the right, rotation to the left, right lateral bending, left lateral bending, and the hips is going to be flexion, extension, adduction. In the knee, we're going to have flexion, extension, and we want to make sure that that's not too extended or flexed. In the ankle, put your ankle up. We are going to have plantar flexion, dorsiflexion, eversion, and inversion. In the toes, we are just going to have flexion, and extension on the toes. Okay, then we're going to assess the knee for stability, just like I'm right now. Scoot over a little bit. And we are going to, I'm going to hold her knee stable and do the Varus test and the valgus stress test, and we are going to assess the LCL, are you okay? And the MCL, and I'm going to hold her leg tight and push on the joint right there and make sure there's no popping, and then this way to make sure that that is stable as well. We're going to do the anterior drawer test. She's going to put her leg up, not too far because I heard you a little bit earlier. I'm going to stabilize her foot and push in and out for the anterior and the posterior drawer test, and while I stabilize her knee. And the McMurray test is going to be, going to take her leg and just go in and out and make sure that that's all normal for her as well. Okay, you can sit up, put your feet around. And then we are going to test for carpal tunnel syndrome. We're going to do the Tenel's and the Fallon's. In the Tenel's, I would take her palm up and tap over the median nerve, spread your fingers apart. And if we suspected carpal tunnel syndrome, she may have numbness and tingling in these last 2 fingers, and you don't, right? Yeah. Okay. Now we are going to do the Fallon's test, and we are going to take the back of her hands and let her push them together for 60 seconds, and if she had any numbness or tingling in her hands while she was doing that we would suspect carpal tunnel syndrome in that as well. We're going to assess her for a rotator cuff tear. Stand up. Okay. We are going to assess her sits muscles and palpate those. are going to do the Apley scratch test. She's going to take, we would do the unaffected arm first, and she would take her arm and scratch, and we would measure where that would be. And now you're going to do it the other way, and it should be about the same point of scratch there. We would also do the drop arm test. We would ask her to put her arm out straight and hold her arm there, and if she dropped it, that would be a positive sign for rotator cuff tear. Or if she extended it a little to the back, then that would mean you're trying to use other accessory muscles in compensation for the rotator cuff. Then we will check her for scoliosis. We're going to make sure that her shoulders are symmetric. We look at her iliac crest and be sure that that was symmetric in her gluteal folds, and make sure that was symmetric. And then of course we would make sure she didn't have a shirt on. She would bend over just at your waist, bend at your waist, and we would make sure that her spine does not have any curvature to it. You can stand up. Okay, then we would assess for low back pain. We would palpate over the paravertebral muscles. Does that hurt?
No.
No? Okay. And then we would palpate for a point of tenderness down the spinal segment. That doesn't hurt?
No.
Okay, and then we'd ask you to bend, and this way. Okay, all right, you can lay back down. You can lay back down. Okay, and we would also bring her leg up and out to see if she had any low back pain that affected that as well. And she does not have any low back pain. For the neurosystem, we're going to assess her deep tendon reflexes, and they can be anywhere from 0 to +4. We are going to test supinator, which is C5 and C6. Biceps, which is C5 and C6. Triceps, C6 and 7. The knee is going to be L2, 3, and 4, and the ankle is going to be S1. So we will take her wrist. We will use the flat side, and we will just tap. We will make sure her arm's flaccid. Just relax your arm. And we should just notice a little flexion in that. And then we will do the bicep, so we will locate, just relax your arm. We're going to palpate over our finger in this and make sure she has a little flexion with her arm there. And now we will do her knee. I'm going to do this knee over here. No, just leave it flat. Yep, just relax it. And we will make sure that she has a little flexion there. And then we would take her foot and let her rest her foot, and we would make sure that she had a little flexion there. Okay, and then we're going to assess for meningeal signs with the Bruditsky, the Babinski, and the Koenig test. And the, lay back down, or I just need your feet. In the Babinski test, we would make an area of circle or trying to make her toes flex. I'm sorry, does that tickle?
Mm-hmm.
Okay, we would make sure that her toes did not spread apart, or she didn't have any flexion in her great toe, and she does not. And we would do that kind of fast. If she did, normally a Babinski sign is positive for until about 2 years old, and then that goes away. For the Koenig test, Okay, for coordination for gait, we would have her stand up, and we would always walk beside our patients to be sure that they don't fall. And we would walk normal and turn around, walk. And then we would have her do heel to toe, which is sometimes considered the drunk walk. We would just heel to toe. And then we would ask you to walk on your toes. And we would make sure that she didn't have any swaying, and then we would ask you to walk on your heels. Okay, and back. And she is okay with her gait. Then we're going to do rapid alternating movements. Sit back on the table. And we are going to do hands to thighs. So I want you to put your hands on your thighs, and you're going to flip them from side to side. And can you do it faster with your eyes closed? Okay? And then we're going to hold your hands up, and you're going to do finger to finger or finger to thumb. And can you do it faster? And with your eyes closed? Okay, that's good. And then we are going to do point to point, and she is going to touch her nose and then touch my finger. Okay. And we are going to do that, and we're going to move our finger prior to her trying to find our finger. That wouldn't be fair for her to have to find our finger while our finger's moving. And then we're going to get her to do heel to shin. I'm going to ask you to take this right heel and slide down the part of your leg, the other shin, and now do it opposite. And of course you would be laying down, but that is normal for her. The wrong bird test, stand up. We're going to ask her to face the camera, put her arms up for 20 to 30 seconds, and we would hope that she would leave her arms there and one of them wouldn't be higher than the other. Can you do it closing your eyes? Okay. Again, close your eyes. And she's normal with that. Pronator drift is going to be her arms up, and I'm going to try to put pressure on her arms. You're going to let me push them down just a little ways. And then you're going to bring them back up to where we were, and she's negative. Then for sensory, we are going to do positional sense, just like we did for the trigeminal nerve. I'm just going to touch you with the end of the Q-tip, and you're going to tell me whether it is sharp or soft.
Soft, 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 soft.
Okay. And let's see, hop up on the table.
Soft, soft, sharp, sharp.
Okay.
Sharp, sharp.
With your eyes closed?
Sharp, sharp.
Okay. Now I'm going to take her finger, and she is going to tell me whether I'm lifting her finger up or down. I'm do this at the joint level with your eyes closed. Am I lifting your finger up or down?
Up, down, up, down, up, down.
Okay, and that is good for her as well. Then we're going to do a vibration sensation. We are going to use the tuning fork with this, and we are going to see if she can tell when the vibration is there. Do you feel it now?
Yes. 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 Now.
And on the foot as well.
Now.
Okay. All right. Then we are going to do discriminative sensation, which is graphesthesia and stereogrosis, and we are going to give her an object to hold in her hand with her eyes closed, and she's going to tell me what the object is. And you're going to feel it and tell me what it is.
Q-tip.
Q-tip, that is correct. And now we are going to, I'm gonna take the end of this, and you're gonna close your eyes, and I'm gonna draw a number in your hand, and you're gonna tell me what that is.
3.
3 is correct. Okay, and that concludes the musculoskeletal system along with the neurosystem for validation video number 4.